I'm here with Jonathan Schaffer from Cleveland Clinic to find out what they've got going on in 2020. Now, Jonathan, tell us a little bit about what's been going on and what we can look forward to.
Well, it's been a very exciting time for Cleveland Clinic. Certainly we have Cleveland Clinic Abu Dhabi. The oncology center is going up and being developed. We have Cleveland Clinic Shanghai, and that program is under development now. In Florida, we're expanding quite a bit with the addition of 2 other health systems, part of our Florida operation. And certainly in Cleveland, our main campus, that's expanding. But also Cleveland Clinic Canada continues to expand to the other provinces. So it's really becoming one Cleveland Clinic globally to really help patients worldwide get the best care that we can possibly deliver.
And let's talk about care and specifically digital care and the importance of that. Expand on how Cleveland Clinic is embracing that.
Well, we've really embraced digital health quite a bit. If you look at the care process, I'm an orthopedic surgeon, and when we operate on somebody, it really doesn't make sense to bring them back to see us if they're mobility constrained. So why not do a post-op visit through a virtual visit so we can do it while they're in the comfort of their home? And we can actually add additional visits during that global period to provide them with greater comfort, reassurance, avoid ER visits, avoid readmission to the hospital, and try and be proactive in the care process. It creates greater patient satisfaction, it leads to better outcomes, and it provides greater value. So integrating these technologies into the episode of care really becomes critically important.
And connectivity is such a big theme for Arab Health this year. How are you guys embracing it?
Well, we're using connectivity to connect every single location on the globe. Many of our patients come from all over. So we can become location agnostic. It doesn't matter where you get care. And if we need to consult with one of our colleagues, it's very simple. We have the technology to do that. Matter of fact, if I wanted to go make rounds on the orthopedic floor right now, I could pull out my smartphone, hit the app, and I can actually see the floor nurses and talk to them. I can see my patients that are in hospital. So it's really outrageously helpful in being proactive in the care process.
Talk to me a little bit about the progress that you've seen.
Oh, it's tremendous progress. How do you make healthcare universal? How do you make it accountable? How do you make it the best you possibly can? And certainly we've been able to help in the Emirates through Cleveland Clinic Abu Dhabi. That's really been very exciting, and to see all the development and changes, it can only make societies better and providing for their citizens.
And tell me a little bit about what Cleveland Clinic is up to in 2020 and beyond. What have you got in the pipeline?
Oh, we have a lot of things in the pipeline. Certainly there's new innovations in the medical care arena, whether it's operative, non-operative, the diagnostics, the care processes. Part of our Care Path program is what we have specifically and how we all treat the different disease entities. So for the orthopedic surgeons in the arthroplasty world, we all follow the same protocols, the same documentation standards, the same instrument sets, because we then measure the metrics and we know what works effectively, and when we make a change, we can assess if it's really helping us or if we need to go back to the drawing board.